Late 1960s, the Black Panther Party recognized that traditional American medical system was failing the Black community through both neglect and active discrimination. In response, they launched the People's Free Medical Centers as part of their survival programs. Now, this was a revolutionary shift in public health operating under the principle that healthcare is a fundamental right, not a privilege for those who can afford it. At its height, the BPP operated more than a dozen clinics across the country, from Oakland to Chicago to Winston-Salem, providing free, high-quality health care to thousands of residents who had been excluded from mainstream hospitals. The impact of these clinics went far beyond basic checkups. They were pioneers in the preventative medicine and community screening. Long before the government took the disease seriously, the Black Panthers launched a massive national screening campaign for sickle cell anemia, which is a genetic condition primarily affecting people of African descent. They also conducted lead poisoning screenings in urban housing projects, and they provided dental care and optometry services. These clinics were staffed by volunteer doctors, nurses, and medical students who worked alongside party members to demystify medicine. They taught community members how to monitor their own blood pressure and understand their own bodies. However, the clinics faced immense pressure. Because they challenged the status quo and exposed the failures of the state, they were frequently targeted by law enforcement and government surveillance. Despite all of this, the PFMC model fundamentally changed the landscape of American medicine. They forced the medical establishment to reckon with the community-based care, eventually influencing the federal government to increase the funding for community health centers. Some of those still serve millions of uninsured Americans today. Now, the modern health connection is clear. Black Panther Party's clinics were the blueprint for what we now call the social determinants of health. They understood in 1970, the medical world is just now fully embracing that you cannot fix a patient's health without also addressing their access to food, housing, and justice. As we navigate healthcare disparities in 2026, the legacy of the free clinics reminds us the most effective healing happens often when the community takes the lead, providing that medical activism is a vital component in the struggle for liberation. Now, the Black Panthers prove that medicine includes food, housing, and justice. Which of these social determinants of health do you think is ignored the most in our current medical system today?